This is Ethan Moore, and I'm going to be demonstrating my transfer technique from bed to chair and then chair to bed. First, you would ensure the patient's privacy, gather your supplies, verify the patient by 2 proofs, their date of birth and the name on their armband, and then you would perform hand hygiene. If you're going to start a transfer from bed to chair, the patient would already be in a seating position. So you would use a gait belt, place it around the patient's waist. Secure it snugly against the patient's waist so that only 2 fingers can fit under it. Then you'd be sure the patient could still breathe properly, that they could still take deep, normal breaths. Then you would spread your feet apart and flex your knees and hips to match their knees. Then you would place both of your hands, grasp the gait belt on the patient's sides with your palms up, and explain to the patient that on the count of 3, you're going to rock in the same direction, and on the count of 3, you were going to rock the patient to a standing position. So 1, 2, 3. Then you would support the patient's knee with your knee and pivot on the foot furthest from the chair. Then you would instruct the patient to use the armrest on the chair to gently lower themselves into the chair as you help them gently lower into the chair. And then you would place the call light next to them in case they ever needed anybody. And then to transfer them back to the bed, you would just reverse the process. Keep your feet spread apart, flex your knees and hips to match their knees. Grasp the gait belt on the patient's side, palms up. And on the count of 3, rock to a standing position. So 1, 2, 3. Support their knee with your knee. And then gently lower the patient into the bed. And as far as delegation tasks go, you could delegate it to a nursing assisted personnel, but the registered nurse still has to be sure that the procedure was performed safely and correctly.